Many of you who have been in the office recently might have left with something that looks a little bit silly, an exercise where you're pulling your head in or rolling your head back or doing the old seventh inning stretch. These movements are part of a system. The system is called the McKenzie Method, and it's something that I have learned to really, really love in the last few years because it is such a game changer for how I treat and manage our patients that come in and the people we work with in the community. One of the primary goals and values of the clinic is that we are patient-centered care, which means we want to get you in the office, out of pain, and back to your life as quickly and as efficiently as possible. And so as we do continuing education, we're always looking for those opportunities. How can I help you better? The McKenzie Method is something that I was introduced to about 5 or 6 years ago and immediately fell in love with because it allows for us to have a new patient come in, and even if you're in miserable pain, I can help you go through a system of evaluation and movement that is directed by you, that helps me to understand the nature of your injury and can actually help us classify and give you better advice on that injury. Because once we understand what it is, then we understand what we need to do about it, whether it's management in the office, referral to an orthopedist, pain management, laser therapy, like how do we approach this? And having that skill set allows us to give you better care and better service. I want you to be able to leave the office having an exercise or a tool that you can continue your treatment when you're not seeing me, because that's going to get you better results and faster. The McKenzie Method was something that was developed 30, 40 years ago by a gentleman named Robin McKenzie, who was a physical therapist. And the whole idea came about by accident, as most cool ideas do. A gentleman presented with some really, really severe sciatic pain and accidentally laid in the wrong position on a table where he was laying in an extension position. And for the first time in weeks, his pain went away. And so Dr. McKenzie, thankfully, was an observant and astute clinician, said, what the heck was that about, and started experimenting. And now I am the lucky recipient of being able to stand on the shoulders of people who have spent decades getting really good at this. So now I can just go sit for a few hundred hours and get a good understanding of how to incorporate this into your care. And so at this point, when you come in, whether it's your neck, your lower back, your shoulder, your knee, your ankle, your foot, your wrist, whatever, we can apply the same principles of movement to direct our classification of injury and then the recommendation for your care. I know that sometimes people have a new injury, like it's snowing out or it's summertime and you're doing landscaping, you hurt yourself and it is brutally painful and you don't want anyone to touch you, and who could blame you? It hurts. The system allows us to get you through that phase faster, more effectively, without you wondering, what should I do? Or God forbid, you're on Google searching what exercises and stretches I could do, because inevitably you're going to get told the wrong thing because it's just a huge pile of info. So ultimately here, we want to use this technique. We want to use what looks like silly exercises and movements to give you the tools and the power to get the best results and make the fastest recovery you can. We look forward to showing you what the McKenzie Method is about this upcoming month, and please reach out and let us know if you have any questions in the comments below.